Go to our website and click on the medical moment.
Injuries are prevalent in sports, and athletes often have to take time off for surgery and rehab. But what if we told you that two of the Pittsburgh Steelers' biggest stars use their own blood to heal injuries before winning the Super Bowl? It's called platelet-rich plasma therapy. And as Mo tells us now in a special medical moment, it's available right here in Michiana.
At least one major league pitcher and 20 professional soccer players have also had this emerging therapy instead of going under the knife. It's done right in the doctor's office, and you don't have to be an athlete to benefit. It can even help softball dads and 5K moms.
I was skeptical at first, and I'm not a real patient person.
Kevin Gibbons is a 24-year veteran of the South Bend Police Department who developed tennis elbow from lifting weights.
Progressed from just being uncomfortable, irritating, to the point where it was painful to pick up a glass or even shake hands or turn a doorknob.
Kevin's doctor, Stephen Simon, suggested an emerging therapy that he was first in the area to use. No surgery, scars, no big hospital bills. Instead, a person's own blood is used to heal an injury. Paula Brilson of Mishawaka got her tennis elbow from actually playing tennis.
It got to the point about a year ago that I started to do cortisone shots, and that really took the pain away, like after a couple of days.
For some people, that's all they need, but for Paula, the relief didn't last. Like Kevin, her pain was chronic, so she opted for platelet-rich plasma therapy. Her blood is drawn and then spun for 15 minutes.
We're going to take out the platelets out of the blood. That's then going to be injected back into her elbow.
Right in this region.
Dr. Simons uses an ultrasound to pinpoint the damaged area, and you can see how painful Paula's condition is with just a little pressure on her elbow.
Right there's the radial head, and up here is the tendon that's the problem.
After finding the spot and marking it, Paula gets a shot to numb her elbow. With his eyes on the ultrasound, Dr. Simons inserts a needle and pokes holes into Paula's tendon so that the platelets taken from her just 15 minutes before coax the body's instinct to repair itself.
Use their own blood, spin it down, get an area called the platelet-rich plasma, which is rich in growth factors, and irritate the tissue by needling it, by poking holes in it.
The platelets working as a type of growth factor cocktail.
I'm just going to inject this stuff.
So she's going to be bruised for a while, probably?
Yes. Okay, we'll get you cleaned up here.
With a Band-Aid and a sling, 45 minutes later, Paula is heading home. Dr. Simons prescribed some pain pills for Paula, which she'll need over the next few days. And over the next several weeks, she should feel gradual relief. Studies show patients have 50% pain reduction at 4 weeks and 60 to 70% reduction in 8 weeks. And as time goes on, the numbers get better. Paula is hoping there may be some more tennis in her future.
I used to have to work on a one-hand backhand, which is not as much fun, but...
As for Kevin...
5 months later, I'm pretty close to 100%.
5 months later, are you back to being able to lift weights?
Yes, with no pain.
So whether you're a tennis buff, a cop, or a professional athlete, a relatively obscure treatment using your own blood to heal injuries could become the standard of care. Platelets have long been known to help the blood clot, but in the last 20 years, research has shown when activated in the body, they release healing proteins called growth factors. In addition to tennis elbow, PRP can also be used for problems with the Achilles tendon and knee and heel pain, and is also showing promise in treating osteoarthritis.
Thanks, Mo. And in case you're wondering which Steelers had PRP before the Super Bowl, you got a little bit of hint there. They're Hines Ward and Troy Polamalu. Both are convinced it got them back in the game. If you'd like to see more on this story, you can go to WNDU.com and click on